Good morning, everyone. I am Alice Crisci, co-founder and CEO of MedAnswers and creator of the Fertility Answers app. I am incredibly excited about adding a Wednesday show to our lineup. And I'm here with a dear friend of mine, Esther Velilla from Fertty International. She comes to us from my favorite city in the world, Barcelona, Spain, and she's with her colleague, Veronica Mazzara. And we are here to talk about medical tourism today. So first of all, welcome, ladies. I'm so excited to have you on the show.
Thank you so much for having us with you, Alice. Always a pleasure.
It's a pleasure.
Oh, good. Well, we're here to talk about something that's near and dear to my heart, and that is medical tourism. And the reason it's so near and dear to my heart is because I see that medical tourism for every area of healthcare is a $15 billion field. I mean, truly a $15 billion field. And when I think about that and how it applies to fertility, we know that if we open up our borders to help people, that there's lots of reasons that they need the help. So what's one of the reasons that people have to travel abroad to access fertility care?
Well, Alice, a lot of reasons. We are treating patients from all over the world, and each country has its own legislation. Each country has difference in economics, difference in culture, different in religion. So if you put all that in one basket, you will see that in every country, every kind of population has different needs. And if they don't have these needs fulfilled in their country, they have to move away because actually the world is global. They don't just avoid the need of or forgo the need of having a baby just because they cannot do it in their country. They move and they go to their target.
A good example of that is you have a lot of patients from France and Germany in which egg donation is illegal. And you have a very robust egg donation program in Spain, in particular at your clinic. So that's a reason. I know same thing in the Chinese market, egg donation is illegal, right? Italy, same, right?
Yes, we are doing 60% of the IVF 3 months for egg donation in Europe are done in Spain because Spain has a very permissive law. The egg donation is anonymous. So that means that we compensate the donors. We don't pay the donors the prices that, for example, you guys are paying in the US. So that makes that all prices for IVF with egg donors are very low comparing to other countries. And the percentage of pregnancy rates are very high. So it's one of the main targets that people, when they think about having an egg donation program, they just travel to Spain because they know that we have a good school of assisted reproduction, good technology, and good prices here.
That is one of the most important considerations, in particular for folks in the US market. In Europe, it's very easy to get around all the different countries, but I think in the US, people still struggle with, I have to go all the way across the Atlantic, to access healthcare. And so I think that we need to break down that barrier of kind of travel, but the cost is so significantly lower, not the quality of care, but the cost itself is significantly lower.
Yeah, but it's the same to travel 6 hours to a flight than to travel 1 hour flight. I mean, the idea of traveling is probably the most important part that patients has to work about. But when they decide to travel abroad, doesn't mind if we treat a French or we treat an American, right?
Yeah, exactly. Yeah, really.
I see. So that makes that helps me understand too. Now in the American market, the prices are so high that I think what we've been acknowledging with our users and with our patients that might be interested in this is that even with the cost of travel, your prices are still about a third of the US prices.
Exactly.
How do you keep your prices so low? I mean, for the US market, they're wondering, well, why are the prices so high? And then on the flip side, they're going to wonder, how are you keeping your prices so low?
Well, our prices are low comparing to the American prices, but you have to consider that in United States, the salaries are higher, 3 times higher than the ones that we have in Spain.
Right.
All consumables are higher. The cost of living is higher. And also you have a third company that takes care of the egg donors. In our hands, we have the egg donors inside our IVF center. We control the program. We don't have to pay a third company for that. And we control and we have a very secure system to have traceability from the beginning to the end of the process because all the process from the egg donor came from our side. So that reduces a lot of the cost, and also what reduces a lot of the cost of the IVF treatment is the payment that
The compensation.
the compensation for the donor. I mean,
Okay.
here in Spain, for example, we pay maximum 1,000 euros to the egg donor because it's what it's organized within all the centers. And in the United States, only for the egg donors, you can pay for 15,000 to 30,000 just for the egg donor. So imagine only reducing that, you have the numbers.
How many patients is Fertty treating per year that are from abroad? Because your entire program is to treat people outside of Spain, correct? I mean, that's why it's called Fertty International. So how many patients? I mean, I've seen numbers that are as high as, 20,000 patients in the fertility field who need access to reproductive services are traveling to access those services.
Yeah, I can tell you that our company, our fertility clinic, is only focused for international patients. We don't treat patients from Spain. We have a system only that is organized for treating for doing 3 months abroad. So our company is only focused on that.
How many languages? How many languages does everyone speak in that program? How many languages do you have represented?
Yeah, our team is really international. So I'm from Italy, so of course I speak Italian. Then in our team we speak French, we speak English, we speak German, Dutch, we speak Arabic. So
Russian?
Yeah. Russian as well. Yeah, Russian as well.
Okay.
So we cover really all the languages. Yeah.
And the U.S. market is so international already.
Yeah, it's really international. So
Yeah.
It's very important to us to customize the treatment for patient. So, and it's very important to give to the patient the possibility to speak their own languages. Yeah.
Well, and it's such a good Sorry, can you restate that, Esther? I want to make sure we get it.
No, I've said that every culture is different. Italian people are looking for one thing probably that's completely different from the German population.
Exactly. Yeah.
And you have to customize what they are looking for.
Yeah.
That makes sense.
It's really very stressful for the patient from the emotional point of view. And as Esther, she said, every culture is different. So that's why we try as well to know the need of the patient and try to customize. So we treat a different an Italian patient than a French or German patient, of course.
That's great. Oh, the emotional side is so difficult. I'm an IVF mama, and that, the journey itself is so difficult that I imagine if I don't feel like someone gets my culture, or I'm worried that I'm going to miss a critical piece of information because I have a language barrier, that could raise anxiety significantly. So I love that you're basically the UN of fertility. If it were, you're basically the UN of fertility. So which is so helpful.
We are very concerned about that. And what we have established is a lot of partners that work with us with an holistic approach, because we're very concerned that when the patients came for a treatment, they have to come with their emotional and physical status as well as possible. So we are very concerned about that, because if they arrive in that position, the success rate will be higher.
Yeah,
absolutely. So what we have is a lot of partners that work with
fertility coach,
acupuncture, reflexology, and fertility nutrition. So these partners that can work online, and also we have some referrals in different countries. So they treat patients in the origin here in Barcelona if they need it.
Great. So talk to us a little bit about kind of the pacing of the schedule, because I alluded to it before, is that sometimes the idea of the length of time it takes can be overwhelming itself. And I think this prevents people from even driving 2 hours to do an initial consult sometimes. Sometimes they drag their feet because they think, I can't take the time off of work, or how am I going to take the time off of work? Talk to us a little bit about the efficiency of the program and how you work with people with that initial consult, and then what you recommend so that you get their labs and their scan and all those things done in home country potentially, so they don't have to go back and forth and back and forth and back and forth. How does the schedule flow?
Yeah, so how we said before, we try to customize each patient. So that's why we have a team of 3 persons for each patient. So that means we have the doctor, the referral doctor. we have a patient assistant and a medical assistant. So the first step is we start the first contact with the patient, the patient assistant contact with the patient, just to have the first information and to ask if the patient she did any treatment before, if she has any medical report, and then depending on the case, we can organize the first consultation with the doctor. This first consultation could be online. We can do it on Skype or on WhatsApp call. So before the consultation, we always prefer that the patient send all the medical reports available if she has the medical report. So the doctor, she can study the case, and then during the consultation, she can already suggest the treatment that the patient she will need. Maybe an IVF with home eggs or maybe an egg donation. So after the consultation with the doctor, the medical assistant will enter in contact with the patient. It's just to inform about the administrative part, so the quotation, and also we send the list of tests required for the treatment. So of course the tests is just to avoid the patient as to travel, she can do all the tests in their country. So normally it's complicated to do the tests in the country because doctors sometimes they don't want to help the patient. So that's why we try to collaborate with some doctors in other countries. So they are like referral doctors that can help the patient to do the tests and the scans. Yeah. So as soon as the patient she gets the results, she can send the results. Our doctor will check the results. We organize another call with the patient just to confirm that everything is okay and she can start the treatment. So even if it depends, of course, on the treatment. So if it's an IVF treatment with a home eggs, normally the patient she comes here and do all the treatment here. If it's for an egg donation, the patient she starts the preparation in her country and she just comes for the transfer.
Which is amazing. I mean, to think about that, you only have to come for what, 72 hours, Esther? How long do you recommend patients?
For an egg donation, they just came, for example, on Thursday. They do a transfer on Friday and they can fly next day for an egg donation. For an IVF, they have to stay from 5 to 7 days. But as Veronica says, if, for example, you have a patient that don't have any referral doctor or don't have any help, we always contact someone near her area. So she can go to the doctor, do the scans, and we put them into contact. And also we have a pharmacy that can deliver the medication to their door if they want. So we have make an operation system that helps to perform the treatment in distance in an easy way, because our main objective is to avoid the need of the patients to travel much, because we know that patients cannot take a lot of days off of work. So we try to avoid all these first days of treatment that could be long. Do it at home with some doctors that we can put them into contact, that we trust, and then they come at the end.
I think that's incredible. I already feel less overwhelmed. I mean, that's really the key, right? It's let's reduce patient overwhelm, because the entire process feels so overwhelming. And adding the travel factor in there can be the thing where I don't know if I can handle that. And we sometimes tell people, go on your second honeymoon. You've already been struggling, but take this couples trip together, to try to access the IVF services in a beautiful city like Barcelona. And, and hopefully it can also be an experience to help them reconnect, because let's face it, IVF can be very difficult on the couple, no matter who it is. If it's, 2 women, 2 men, a male and a female on her own, a male on his own, this whole experience of just having to go through a struggle to have your child is already so stressful and overwhelming, and it can disconnect a lot of people. So I love your approach so much. Tell me a little bit about when you have the program where you can actually export the embryo. Probably poor choice of words, but where you can ship the embryo actually to the United States. Because as I understand it, you're only one of 2 clinics who has FDA clearance to be able to do this.
Yeah. We have been enrolled into the FDA, so we have the clearance for the FDA to ship gametes or embryos in and out the United States. The only thing is that in order to ship the embryos, we have to fulfill all the FDA requirements. So if one patient is thinking about, I cannot travel because I don't have visa, or I cannot take days of work, so I cannot go out from my country, what we can do is to get into contact with an IVF center that we can coordinate that they can freeze the sperm there, send the sperm to us, then we create the embryos, and we have the embryos frozen. We can ship back the embryos to the IVF center in USA, and they can do a frozen embryo transfer there. We can do that. It's a different program completely because we have to know that in advance, but it's a possibility that we have organized for those people in USA that don't have visa. There are a lot of people that cannot travel for any reason.
Oh, sure. So yeah.
It's one operations that we have established for that. One thing, Alice, another important thing is that we have a line on the phone and open every single day. So patients can contact with the doctor anytime and with the medical assistants anytime. And that's very important because sometimes the doctors are very far away in some kind of treatments. And we want them to be sure that they don't have any concern and they are very calm and relaxed for the treatment. And we have focused a lot of energy on that because for us it's very important to show complete transparency for the patients.
Now, you also have a really unique program that I want to close with, and that's the live birth refund guarantee. Now, we see a lot of pregnancy guarantee programs, but this is an extraordinarily bold step on your part, Esther, when you're setting up the program, that you actually have gone the extra mile and said, no, we will refund you if you don't have that baby in your arms. I think it's unreal. So can you describe the 2 programs? Because there's 2, I believe, right? One with egg donation and one with IVF.
The standard egg donation program, we can assign the number of mature eggs based on the demand of the patient. We can have a program of 4 mature eggs, 6, 8, 10, or an exclusive donor. The most common program is from 8 to 10 all sides, because with 8 to 10 we can have 3 nice blastocysts, and we don't want a lot of babies with just one or 2, right? So it's enough for a patient. But with that program, we also have some guarantees, because we consider that when a patient have the decision to travel so many miles from one country to another, they need a guarantee. They cannot come here and say, we don't have any blastocysts, or we don't have any embryo to transfer. So it's quite, we know that biology is quite curious, and we are never 100% sure that we will have a nice blastocyst, because that will depend with the genetic of each person. But we have very good pregnancy rate, we have good quality of the laboratory, and we can guarantee that on that program with 8 mature eggs, we guarantee 2 blastocysts on day 5. That means that they will have 1 nice blastocyst to transfer in a fresh cycle, plus another blastocyst to get frozen for a following cycle. That's the main guarantee in the standard program. The other program is the one that you talk about, is the live birth guarantee program. That is quite scary, I know. But we are very happy with our pregnancy rates and with the technology that we have on the lab and the system we have established. So now we can establish that program of the live birth. On that program, we guarantee a live birth baby in 3 IVF cycles. The patients pay 18,000 for an egg donation program. They pay 18,000 euros. And with that money, we have 3 cycles, IVF cycles, to get them pregnant. That means all these 3 cycles plus all the frozen embryo cycles that will be generated from these cycles. For example, if the first IVF cycle we have 4 blastocysts, that means that we have 1 fresh blastocyst plus 3 frozen embryo transfers to go ahead.
Amazing.
Right? And all the medication is included, all the medical part is included for any cycles.
Wow.
And we could do that thanks to our collaboration with a financial company, IVF Redia, that is taking care of the financial part.
I mean, I'm dumbfounded over your pricing, because you're 3 IVF cycles for less than the price of 1 in the US, with the guarantee of a child, and that's with an egg donor or without? I didn't catch that part.
With
an egg donor.
With the egg donor,
That's amazing.
backup donor, medication of the donor, all of them.
Donor, backup donor, medication for the donor, medication for mama to be, or parent to be. That's incredible. Wow. Yeah. Oh, I have more questions, but we're running out of time.
When people are thinking about traveling abroad and they are thinking about those programs, are in a phase that they have been through a lot of IVF cycles. They have been spending a lot of money. They have lost a lot of things. So they need some guarantees, because we don't have a patient that they came for the first cycle. Most of the patients that came to our clinic, they did a lot of cycles before. So they came in a very complicated moment.
Got it. So one of the unique things about Spain, and we'll kind of close with this thought, is when you do an egg donation cycle, the clinic does the matching, correct? Yeah. So they're not going to be going through profiles like they do in the US, but you do the matching. And do you match based on the criteria that the intending parent says is important to them, or are there guidelines in Spain that you have to follow?
We have some guidelines. I mean, the legislation says that the person that is responsible for this matching is a doctor. So the doctor is going to look for the perfect donor. We match considering the color of the skin, the ethnicity, color of eyes, color of hair, and height. With all of that, and also if the patient wants, we can do genetic matching, because we test all the donors for more than 600 genetic recessive disease. So if the patient wants a genetic matching, he can be tested, the male partner can be tested, and we can do the genetic matching with the donor. But we will always consider as a first criteria the phenotypical and ethnicity, and also the fertility proven donors. For example, if I have 2 donors candidates, and one is fertility proven and the other is the first cycle, we will go for the fertility proven, because what we want is to get a pregnancy in a short-term time. So the doctor is the one that is responsible for that.
Okay, got it. Well, I love this. I mean, I think the key takeaway, and we'll wrap up for the morning, is that this is the idea of medical tourism is not a new one. It has been applied to the field of fertility for many, many years. I think the US has been a little slower to go to other countries for IVF. It's been happening so frequently. For the Chinese market exploded for surrogacy cycles coming to the US, going to Europe, going to Thailand, but it's always happened in Europe. And I think that this is such an important concept for people to understand, that if cost is a barrier to someone achieving their ultimate dream of having a family in the US, they can do this even with the cost of travel and still have it be lower cost than in the US, and have that guarantee, which I think is just an incredible value proposition to patients, here. And that really is the takeaway, and I'm telling you, Barcelona is one of my most favorite cities in the entire world. So you can at least go and expect amazing food, amazing energy, amazing company. It's the most colorful city, so if this has been a really stressful experience and someone is considering this, then Spain certainly has my vote. Thank you, Esther. Thank you, Veronica, so much for coming on this morning. Yeah, and enjoy the afternoon, evening for you all, since it's a lot later in the day there. And we'll see everybody.
And Alice, you're welcome to come to Barcelona anytime.
I know, thank you. We'll get Dante over there so you can have a play date with your kids.
Perfect.
Thanks, everybody. You can check us out. Monday Motivation is at 2 p.m. Pacific time, 5 p.m. Eastern with Dr. Serena H. Chen. Fertility Tip Tuesdays at 4 p.m. Pacific with Dr. Raquel and myself. And then Wednesdays, we're doing a rotating schedule just to keep you on your feet. So thanks so much to Fertty International, and we'll see you next week.
Okay, thank you. Bye.